Alright, hi guys, how are you? This is Dr. Kim here. So this video is a continuation of the previous video that talked about the positioning and visualization of Mesioden seen on panoramic radiograph and periapical radiograph. Since then, we have now captured a CBCT scan of this area, so I want to share that with you. Just to recap the previous points, initially we noted that there was this opacity, and from the video you should have known by now that this is a Mesioden, and from this we really couldn't tell whether this was truly a Mesioden or not, and I think that was the point, that when we take a look at periapical radiograph, it's much clearer that you can actually see the full shape of the Mesioden, right? So that was the point from the previous video, and the question is now, when you look at this, it almost, I talked about, it looks almost inverted. It appears inverted, and there appears to be dilaceration, but as far as whether this crown is buccally pointed or whether it's facing palatally, we really don't know, right? And how severe is this dilaceration, if this is true dilaceration? So those are some of the questions that is still remaining. And so now let's take a look at Chromium CT and find out what's the true position of this Mesioden. So there you go. So this is a Chromium CT. Again, we're seeing axial view here and the coronal and then the sagittal view, and I basically put the crosshair right directly over the area of interest, and you should immediately be able to tell that the crown is in fact facing palatally, okay, along the palatal cortex, so much so that it has caused the expansion of the alveolar process and significant thinning of the palatal cortical plate. So see how thick it is, and suddenly it becomes very thin at this area toward the tip of the Mesioden, right? So it's very thin. It's possible that maybe it's focally fenestrated. So those are some considerations. It occupies the full buccal lingual thickness of the alveolar process, right up against the buccal cortex. So yeah, so it's actually horizontally positioned rather than inverted. So that's another thing that we were kind of thrown off based on the view from periapical radiograph. Again, keep in mind, when you take a periapical radiograph, the beam doesn't come horizontally, but rather the beam comes at an angle, 90-degree angles, to the sensor and the long axis of this incisor. So when you have the angulated appearance, this horizontally positioned item, or the tooth, will appear somewhat inverted, because again, visualize that the beam is coming in this direction, and the beam that captures the crown information is captured in the upper half of the sensor. So again, visualize sensor positioning, position parallel to the long axis of the tooth. So the beam comes in this way to carry the information of the crown and register it at the upper half of the sensor, and then the root information is carried out by the central ray coming in this direction and capturing at the middle level, or at least below the information of the crown. So hence appearing inverted. So that's very important to note that. I don't know if that made any sense to you. I wish I explained it a little bit better, but just keep that in mind, because of that angulation of the beam and the position of the sensor, you're never gonna have a complete comprehension of the spatial orientation when you take a two-dimensional image. It's always better to have three-dimensional Chromium CT image in order to determine the spatial orientation and relationship. So it's a once again horizontally positioned Mesioden, and let's see how significant that dilaceration, if there is any, right? On periapical radiograph, it looked as if there's significant dilaceration, but again, do you see a lot of dilaceration? Not really, right? So here's a tooth, right? Here's a tooth between 8 and 9, and I don't see a lot of dilaceration. If you want to call this a slight band dilaceration, that's fine, but certainly it doesn't have that bend like we saw on periapical radiograph. Again, right, we're kind of fooled by its appearance on periapical radiograph. So again, you can see how important it is to take a cone beam CT scan prior to extracting tooth such as this, because it gives you exactly where it is located. You can make a measurement from the CJ area to the apex of the mesioden, or from here to here, so you know how far to make a flap or where to expose the bone, to expose the crown. I mean, all of that can be obtained from this single cone beam CT radiograph. And if you're concerned about radiation dose, we should always be mindful of radiation dose. You can see the image quality is not optimum, right, compared to some of the other scans that I've shown you. It is because we've used ultra low dose setting in this case. So the radiation dose, if I recall, in this cone beam CT scan is about 1/3, if not quarter, of a typical radiation dose that's given for this limited field of view. So when you take a limited field of view, the radiation dose is already relatively small in comparison, but by using this ultra low dose setting, now that the dose has been even further reduced to about the quarter, or if about the quarter of its original radiation dose. And I would have to actually look up the chart to see what it is, but I think the radiation dose or effective dose from this limited field of view is very comparable to a few periapical radiographs. So it's not a lot more radiation dose than you might expect. So being able to get this information at the cost of maybe 2 to 3 periapical radiograph, that's terrific, right? Yeah, so it's really good information. So yeah, that's what I want to point out, and certainly we can spend more time to determine whether this mesioden has caused any root resorption of the adjacent teeth or not. That's something we can look into. But just very impressive that how easily and we can study the shape and location or orientation of the tooth, and how difficult it was on periapical and panoramic radiograph. And also we can see that because the root length is limited by the alveolar process and the buccal cortex, and there's very thin, if there's any, buccal cortex, and you can sort of see the shape of the root that's been somewhat perhaps dilacerated or develops to accommodate the normal anatomy of the alveolar process. So yes, very interesting, right? So hopefully this was another interesting case for you to learn. I know that not most of you, if not many of you, do not have an access to cone beam CT, so this is my way of sharing interesting cone beam CT scans with you. So if you like the video, I'm trying to grow my channel, please hit the like button and be sure to subscribe so that you can see interesting cases whenever I upload these 3 times a week. So thank you again for your attention, and I'll see you in the next video. Take care.